Hello, everybody. This is Wendell Cole, orthopedic sports surgeon, and this is our technique for arthroscopic assisted anterior inferior glenoid fracture fixation. So, our patient is a 58-year-old male who had a fall while snowboarding. He sustained a shoulder dislocation that was reduced as an outside facility, and he was also noted to have a glenoid fracture, a non-contributory past medical history. And on physical examination, he had a lot of pain, swelling, decreased range of motion, and some apprehension. So these are images which are multiple x-rays, which shows a glenoid fracture. This patient also had an MRI, which shows a slap tear, also the glenoid fracture, and some partial tearing of the rotator cuff. Here are the sagittal images, where you can see a little bit more of the glenoid fracture. And here are the axial cuts, where you can see the anterior part of the glenoid fracture. And this patient also had a CT scan. And here are the sagittal cuts, where you can see the bony architect of the fracture a little bit better. You can see a little bit of that comminution. Again, these are the axial cuts, and here we have the coronal cuts, which shows the displaced fracture. So this patient elected to proceed with surgical intervention and wanted to fix, very active. So this patient is placed into the lateral decubitus position, and then the diagnostic arthroscopy is performed, which can be a little difficult secondary to the subluxation of the humeral head medially, but you can see the fracture on this patient, some labral tearing, also has a defect of the cartilage on the humeral head, some undersurface tearing there as well. So an anterior superior portal is established, as well as an anterior inferior portal is established right above the subscap. A shaver can be brought in to help debride some of the tissues, and an elevator is used to elevate some of the inferior labrum, as this is where we'll be putting our anchor. The elevator can also be used to help free up the fracture fragment, as is seen here. It's actually a pretty useful tool for this. And we are now passing a wire through the inferior portion of the labrum right around the 6 o'clock, 7 o'clock position, and we are passing a wire, and then we're going to pass a luggage tag or a luggage stitch, or basically the suture is pulled through, and we go through the loop and pull that out. And here another tag is being placed along the superior aspect of the labrum, and this is used to help control the fragment and can be used to help reduce it. So here we are coming in, we're looking from the superior portal, and we are freeing up the fracture fragment, and you can also use a freer to help free it up. But we're using this shaver. The superior portal gives you a pretty good view. And now, once you have freed up your fracture fragment, the sutures are placed into two knotless anchors. One was placed inferiorly, and then this is the anchor that is going to be placed superiorly here. And you can already see, just with the soft tissues, that this helps get some of a reduction of the fragment itself. And so now what we're doing is we're going anteriorly, and we're clearing off the soft tissues off the glenoid neck on the anterior aspect of it. So this is where our eventual wires are going to come out. So we're taking care just to have good visualization and clear this area up so we can see. Now the sled is placed in the posterior portal. This is kind of what it looks like. You want this to be perfectly parallel to the glenoid. If it is not parallel, you should make an accessory portal and make another posterior portal, because that might cause you to drill through the cartilage when you're doing a drill. So this guide is placed at the aspect of the fracture, and here this can actually be used as a reduction tool. And on the back part of this jig, it is placed down to the posterior aspect of the glenoid. So now, again, make sure that's nice and even, and through the guide you drill two holes. So you drill one superiorly, or more one superiorly, and as well as one inferiorly. And you can see us drilling it here, and we made sure to not penetrate the subchondral surface. So now we are passing nitinol wires to pass our cortical button fixation on the inferior and posterior aspect. And then this is sequentially tightened on the posterior glenoid. And you can see here that the reduction is nice. We had a good articular congruity, and the soft tissues are nicely reduced. And you can see the cortical buttons here on the anterior aspect of the glenoid, which are then cut sequentially. Here are the postoperative radiographs, and thank you for watching.